It's a bit of a trick question, Nathan, but how many of the people that looked after your wife at the hospital in Wolverhampton do you think were immigrants?
Well, when we were there, we saw about 4 different people, and I think 2 of them were foreigners and 2 of them were British.
Okay. So that would be 50%.
Yes, yeah.
Okay. Well, I hope she was well looked after, and I hope she makes a full and speedy recovery. And I hope the 2 people who were born somewhere else who treated her aren't listening, Nathan, because what do you think they'll feel hearing you today?
Well, I mean, for further context, just
answer that. Come on, you keep complaining.
I'm actually an immigrant myself.
No, I realise that. I thought you might be, but in terms of how those healthcare workers feel to hear you saying,
What is up, everybody? Harry here. This is James O'Brien on LBC with a caller named Nathan, who says immigration numbers are the reason for NHS pressures, long A&E waits, and his own wife's 6-hour hospital wait. O'Brien pushes back with a specific historical comparison. NHS patient satisfaction was at its highest ever in 2010, after 13 years of high immigration under Labour, and then asks Nathan a question that gets genuinely interesting. How many of the staff who treated his wife were immigrants themselves? This is a real, contested policy debate about immigration and public services. So I'll try to keep this fair to both the data and Nathan's lived experience rather than just picking a winner. Get subscribed if that's useful to you. Let's get into it.
Hi, James.
Hello.
Yeah, so I just want to answer your question of whether the numbers do matter. And I want to say, yes, the numbers do matter. Now, for context, I have to say that I guess I would fall in the camp that you've described of people who subscribe to quote-unquote right-wing media.
sure.
I share the same sentiments and views as the ones that you're demonizing, for lack of a better word. But I don't want to
jump all over you. No, I don't want to jump all over you. But just give me a little bit more flesh on those bones, if you would. What sort of sentiments and views?
Well, I mean, the conversation for today is about immigration, and you describe the people who, I guess, view immigration as a big issue and something to be sorted, and I guess, in your words, sort of blow it out of proportion. But I sort of agree with a lot of that rhetoric. And to come back to your question, of course, the numbers do matter. Now, I wasn't a fan of the Labour government. I wasn't happy that they got in power. But when I heard the news about the numbers that you've spoken about, yes, that did put a pep in my step. I was like, oh, okay, this could actually be a good thing. So ultimately, for me, it's about the impact that's happening as a result of that government. So if they get this right, if it improves the country, I think that's a good thing. And
what would we be looking for in the context of improvement?
So in terms of to answer that question, let me just emphasize on the numbers. It's great that the numbers are coming down, but at the end of the day, it's about the lived experience of the people in the country.
Yes.
So the reason that people pick up on immigration is because immigration puts pressures on services on the country. So healthcare, education, community services and stuff like that. So the more people there are, the more those services are under pressure, and people feel that. Jobs are harder to get. When you go to the A&E, you wait for 5 hours. I was there a couple of weeks ago because my wife was unfortunately very, very unwell. We got there, and they told us we had to wait for about 6 hours. It's those kind of.
And in those circumstances, you immediately think of immigration.
No. I don't immediately think of immigration, but it's a factor that I can't ignore because
14 years of austerity. In the year 2010, patient satisfaction with the NHS was the highest it had ever been.
No,
that was after 13 years of high immigration under Labour. So why do you think of immigration when you're presented with a long wait at a hospital?
No. So that's fair enough, and this is my point.
To add another point, if I may, the net contribution to the public purse of a working age immigrant is higher than a working age native. So in terms of what goes in and what gets taken out, they're a net benefit to public services, and yet in your mind they're a drain. Why do you think that is? Because respectfully, you're wrong. So why do you think you've ended up being wrong about this?
No. Well, I mean, fair enough. Respectively, I think you're wrong, but it doesn't matter. We'll just have a
this
conversation.
isn't an opinion. This is counting. You go to a hospital and there's a long waiting list. You immediately think it's because of immigration. I just wonder why.
No. I didn't say that. And this is the thing, James.
You did, mate.
No. I think
you told me about your wife, who I hope is well and was as well treated, and you talked about the lived experience of people and believing that immigration was the reason why you had such a long wait at the hospital. I mean, you can tell me that you made a mistake when you said that, but you can't pretend you didn't say it.
Let me explain. It was a mistake. From what you're saying, I'm hearing that you misunderstood me. So let me clarify.
Of course.
Okay. What I'm saying is, the fact of the matter is, if there is 1 million more people in the country, those 1 million more people need to use the same services that were there before they arrived in the country. So if I have a hospital in Wolverhampton, this is where I live, there's that hospital. If 500,000 more people come to Wolverhampton, it's the same hospital, James.
And are they? But then we look at the age. We look at the age demographics. We look at the staffing of the hospital. We look at who is most likely to need care in the health sector and who is most likely to provide it demographically. And you come away with a fairly powerful argument for immigration, not against it. And you can't really gloss over the fact that patient satisfaction under the last Labour government up to 2010 was the highest it has ever been. So why? If there were hundreds of thousands of people coming into the country during that period, was patient satisfaction the highest it's ever been? Millions of people.
Because, and this goes back to your central question that you asked at the beginning. So let me answer your question. If you just let me answer the question.
Well, I wish you'd answer one of them.
It's great the numbers are coming down, but it's not about the numbers, James. It's about the lived experience of people in this country.
So the lived experience of people in this country in 2010 was that after incredibly high, historically unprecedented levels of immigration, the experience of the NHS was the highest it had ever been. So your point just doesn't work.
No. Let me make it first, James, and then you can tell me whether it doesn't work. My point is, even if immigration numbers were going up right now, even if immigration numbers were 1.2, 1.3, but the lived experience of the people in this country was getting better. If we could all look at each other and say, you know what, England is getting better, this wouldn't be a conversation.
Yeah, I mean, you might be right about that, but that's why I always ask for examples, and I know how annoying it can be, and in many ways you're demonstrating why some people do find it so annoying. But, there it is. The problems that the NHS face are not directly linked to immigration levels, because when immigration levels were high enough to essentially start the entire Brexit ball rolling, patient satisfaction with the NHS was the highest it has ever been. And listen, this is a bit of a trick question, Nathan, but how many of the people that looked after your wife at the hospital in Wolverhampton do you think were immigrants?
When we were there, we saw about 4 different people, and I think 2 of them were foreigners and 2 of them were British.
Okay. So that would be 50%.
Yes, yeah.
Okay. Well, I hope she was well looked after, and I hope she makes a full and speedy recovery. And I hope the 2 people who were born somewhere else who treated her aren't listening, Nathan, because what do you think they'll feel hearing you today?
Well, I mean, for further context, just
answer that. Come on, you keep complaining.
I'm actually an immigrant myself.
No, I realise that. I thought you might be, but in terms of how those healthcare workers feel to hear you saying...
Well, look, to hear me say what, though, James? I didn't say anything.
That immigration is the reason why the NHS can't provide the services that those people would like to.
And listen, it's your show. You can do whatever you want.
I have listened. I've listened a lot, Nathan.
I think the issue...
And as I say, I hope your wife has a full and speedy recovery, despite having to endure the ministrations of fellow immigrants.
Watch the exact structure of O'Brien's central argument, because it's worth being precise about what it does and doesn't prove. He notes NHS patient satisfaction was at its highest recorded level in 2010, following 13 years of comparatively high immigration under Labour, and uses that to challenge Nathan's instinct to link current NHS strain to immigration levels. That's a real verifiable historical data point. Satisfaction surveys from that period do show a peak around then in a genuinely useful check on the assumption that more immigration mechanically produces worse outcomes, since the period saw both high immigration and high satisfaction simultaneously. What it doesn't fully settle is causation in the other direction. That period also saw sustained real terms increases in NHS funding, arguably the more direct driver of the satisfaction improvement, and O'Brien's own explanation leans on exactly that point later when he attributes current NHS problems to austerity rather than population growth. Both immigration and funding changed across that period, which makes isolating either one as the sole cause harder than a single correlation can establish. The net fiscal contribution claim is also broadly accurate as commonly measured. Multiple independent analyses, including from the Office for Budget Responsibility, have found working age immigrants, particularly those on skilled or study routes, tend to make a positive net contribution to public finances relative to the wider population, since they're disproportionately of working age and paying in without yet drawing on pension or elderly care costs. That's fair and well supported. What it doesn't directly address is Nathan's actual underlying concern, which isn't really about national fiscal contribution, it's about local capacity. Whether a specific hospital or GP surgery in a specific area has expanded fast enough to match specific population growth in that catchment. National fiscal averages and local service capacity are different measurements. And a policy can be a net positive nationally while still creating real short-term strain in specific places if infrastructure investment doesn't keep pace locally. A legitimate planning question distinct from whether immigration is good or bad for the country overall. The moment where Nathan is asked how many of his wife's caregivers were immigrants themselves is worth examining for what it actually reveals, separate from any gotcha framing. It doesn't disprove Nathan's capacity argument, since staff being immigrants and services being under strain aren't mutually exclusive facts. What it does surface clearly is an inconsistency in how Nathan frames the same population of people contributing skilled labor that directly benefited his family in a moment of need, while simultaneously being cited as a source of the system's strain. That tension is worth naming precisely, rather than dismissed either as a decisive rebuttal or as an unfair trick question, because it points to a real distinction worth making in this debate. Immigration's effect on healthcare capacity as staff versus as additional patients are two separate questions this call blends together throughout. Nathan's core claim that population growth requires proportional infrastructure investment to avoid strain on shared services is worth taking seriously on its own terms rather than as a proxy for a view on immigration generally. That's a real and reasonable planning principle that applies regardless of where population growth comes from, whether through immigration, birth rates, or internal migration between regions. Where this call leaves that question genuinely open is whether current local infrastructure investment has actually kept pace with population change in the way it needs to. A specific, checkable planning question this exchange raises, but doesn't answer either way. If breakdowns like this are useful to you, get subscribed to Harry Unfiltered.